All right, buckle up, everyone, because today we're diving deep, deep into a topic that affects us all. It's periodontitis.
Uh,
And we're going way beyond brush your teeth twice a day. We've got some serious medical excerpts here that are going to make you a periodontitis pro.
Yeah, it's funny. People hear gum disease and they think it's no big deal. But periodontitis, that's a whole other level of not so fun. And the thing is, it's way more common than you think. We're talking almost half of all adults over 30 are dealing with it.
Okay, whoa, so this is serious stuff then, not just like a little bleeding when I floss?
Nope, not at all. Our source calls it out as a straight-up severe bacterial infection. And it's not just your gums taking a hit, it's attacking the bone that holds your teeth in place.
Wait, really? What bone?
The alveolar bone, it's like the foundation of your smile.
So basically, my teeth are losing their anchor. Yikes.
Exactly. If gingivitis is a little nudge, periodontitis is like, hey, I'm here to cause some damage. You do not want to lose teeth because of this. Right.
Absolutely not. Okay, so what do we do about it? So how do we know if it's gone too far? Like if we've crossed that line from just gingivitis to full-on periodontitis?
That's the thing, right? It can be sneaky. People ignore the early signs all the time.
Well, what are we even looking for?
So the source mentions receding gums, and you might just think, oh, my teeth look a little longer now.
Right, like is that such a bad thing?
It can be, because it might not just be your teeth, it could be bone loss.
Okay, now that's scary. What about bad breath? I mean, we've all been there, but when is it a red flag?
That's a good one. Our source actually points out that if you've got that persistent bad breath, even after you brush, could be bacteria hanging out
And they like to hang out.
in those deep pockets that gum disease creates.
Exactly. So morning breath is not so funny anymore. Okay, anything else we should be on the lookout for?
Ever notice a change in your bite? Like your teeth just don't fit together the same way they used to.
Like if your bite feels off.
Exactly. A lot of times people will blame it on an old filling or something, or think, oh, I guess my bite's just changed.
Right, right.
But it could be your teeth actually shifting because of, you guessed it, bone loss.
Wow, okay, so we're like detectives now examining every little thing. What about when your gums just feel sensitive? Like they bleed a little when you brush? Is that always periodontitis?
Not always. It's really important to know the difference between gingivitis and periodontitis.
Okay, yeah, good point.
Gingivitis is like the first stage, right? Your gums might be a little irritated, you might see some bleeding, but the damage is still reversible at that point.
So gingivitis is like the yellow light warning you to slow down,
Right.
civic pie, and periodontitis is the red light you've gone too far.
You got it.
Okay, so let's say some of those red flags are starting to pop up, like maybe your gums have been a little too sensitive lately. What can you actually do about it?
Well, that's where treatment comes in, and our source actually lays out all the options really well.
Okay, walk me through it.
So it basically boils down to two main approaches. You've got your non-invasive treatments, and then, of course, there are the invasive options. And as you might guess, we always try the non-invasive route first.
Makes sense. So what does non-invasive even mean when we're talking about, like, gum disease?
Good question. It starts with a deep cleaning, but I'm not talking about your average toothbrush and floss routine here. We're talking scaling and root planing.
Scaling, yeah, I've heard of that. That's more intense than regular cleaning, right?
Way more intense. We're getting in there and removing all that stubborn plaque and tartar, that hardened stuff that your toothbrush just can't reach.
And root planing, that's part of scaling.
Kind of. It goes hand in hand. Root planing smooths out the surface of your tooth roots to prevent future buildup. It's all about creating a clean slate for your gums to heal.
Okay, so it's like hitting the reset button, but I've also heard about lasers being used for gum disease. Is that like the high-tech solution everyone's been waiting for?
Lasers can be helpful, but it's not as simple as zapping away the problem. They're often used alongside scaling and root planing to help break down the tartar, but they're not some kind of magic wand.
So no skipping straight to the lasers then.
Not quite. And if you are considering laser treatment, make sure you're seeing an ADA-certified dentist. That means they've got the training and experience to use it safely and effectively.
Got it. Always good to be sure. Now, the source also mentioned a medication.
Right, medication can be a really important part of treatment, especially when it comes to controlling that bacterial infection.
So what kind of medications are we talking about here?
Well, your dentist might prescribe oral antibiotics to tackle the bacteria systemically.
Okay.
And then there are topical antibiotics. These come in gels or even tiny little microspheres that get placed directly onto your gums.
Hold on. Microspheres. Are we talking about tiny robots fighting bacteria in my mouth now?
Not robots exactly, but it's pretty cool stuff.
Mhm.
Microspheres are basically tiny particles that contain medication, and they slowly release that medication over time, right where it's needed. It's like targeted therapy for your gums.
Okay, that's pretty wild. What about mouthwash?
Oh, yeah, medicated mouthwashes are great too. They can help keep that bacterial growth in check as part of your daily routine.
Right, right. So those are all the non-invasive options, but I'm guessing those are typically for the less severe cases.
Mm-hmm.
What happens when things are more serious, like the S-word surgery?
I know, it's a little scary to think about, right?
A little.
But surgery is usually only recommended for those more severe or complicated situations, like when there's already significant bone loss or deep gum pockets.
So, like, what kind of procedures are we talking about here?
Well, one common procedure is called a periodontal pocket procedure, or sometimes it's called flap surgery. It sounds kind of intense, but it's really about getting those deep pockets under control.
How does that even work?
Basically, the periodontist will lift back the gums to really clean around the roots. And then they suture the gums back into place, usually a little tighter this time to help reduce the pocket depth.
So it's like a super deep clean.
Exactly. The goal is to make it easier to keep those areas clean, both for you at home and for your dentist during checkups.
Okay, that makes sense. The source also mentioned gum grafts and bone grafts, and those sound even more serious.
They can be more involved, but they're really incredible tools for rebuilding what's been lost. Gum grafts are used to reinforce areas where your gums have receded, and they usually involve taking a small piece of tissue from the roof of your mouth.
So you're rebuilding the gum line, essentially.
Exactly. And then bone grafts, those are used when the bone supporting your teeth has been damaged. They use a special material, sometimes your own bone or a synthetic one, to rebuild the bone and help stabilize those teeth.
Wow, that's incredible. So I'm guessing the goal is to avoid needing those procedures at all, right?
100%. Prevention is key when it comes to periodontitis.
So let's finish strong. What can we all be doing every day to keep our gums healthy and avoid becoming a statistic?
It all starts with the basics, honestly. Brushing your teeth for a full 2 minutes, twice a day, using fluoride toothpaste and a soft bristled brush. And remember those deep pockets we talked about?
Oh, yeah.
That's where flossing comes in. You've got to floss every day to reach those areas your toothbrush can't get.
No excuses.
Exactly.
Yeah.
And see your dentist for regular checkups and cleanings. They can spot the early signs of gum disease and give you personalized advice for a healthy mouth.
Okay, so brushing, flossing, regular checkups, non-negotiables. We also talked about smoking and diabetes as risk factors. How do those play into the whole oral health picture?
Great question. Here's the thing. It's all connected. Smoking actually weakens your body's ability to fight off infection and heal. Not good for your gums. And uncontrolled diabetes also increases your risk because it affects your body's ability to control blood sugar, which leads to inflammation, including in your gums.
Wow, it's crazy how many different factors play a role. It really makes you realize that oral health is about so much more than just a pretty smile.
Absolutely. It's all connected to our overall well-being.
Well said. And there you have it, folks. We've gone from those subtle warning signs to high-tech treatments and even some surgical options. If you felt clueless about periodontitis before, you're practically an expert now.
I wouldn't go that far, but you're definitely well equipped to have a more informed conversation with your dentist. And that's really what matters, taking charge of your health.
100%. Now, before we wrap up, I want to leave you with one final thought. We've covered a ton of ground about the physical aspects of periodontitis, but what about the connection between oral health and, say, mental health? Could stress or anxiety actually impact our gums? It's something to think about as we all continue to learn more about the fascinating connection between our minds and bodies.